Let's talk to Tess Ingram from UNICEF. She's in Gaza City. Tess, welcome back. Good to see you. Given your experience, what will the withdrawal of US aid mean?
The money that comes from the international community for the people in the Gaza Strip is essential. It's essential to our efforts and it's essential to their well-being. I have been here in the north of Gaza for a week now and the needs are enormous. People desperately need that humanitarian assistance to continue, both the supplies that we've been bringing in on trucks, 10,000 in the first 2 weeks, but also the services that we're scaling up like mental health support and nutrition screenings. So it's integral that at this moment in time, when there is such great need here, that the international community steps up and not back.
Aid is reported then to be coming into North Gaza. Is it enough?
Not yet, no. We can't undo 15 months of deprivation in 2 weeks. We're talking about really serious needs here, particularly with volatile weather for the last 48 hours. You can really see that people are suffering outside in the cold without adequate shelter, without warm clothes. I've seen many children without shoes. So we really are making a dent in a very, very large pool of need, and we are determined to continue our efforts. But for that to happen, we need this ceasefire to be sustained for as long as possible.
What are the biggest challenges, the priorities in healthcare for those in Gaza?
In healthcare specifically, we're quite concerned at the moment about the impact that this current rain is having on people, the potential of diseases spreading. There's already a very high rate of respiratory infections among children, and also with the damage to water and sewage networks. That means that if there's perhaps leaking sewage that then is spread by the floodwater into places where people are living, raising the risk of diseases like diarrhea in children, which can be a real killer. So we're concerned about that, particularly with the impact on the health system at the moment. Of course, there's very few functioning hospitals here, and the ones that are still operating are not operating at full capacity. So that's a concern, and UNICEF is trying to bring in medical supplies, nutrition supplies, and scaling up services like immunisation to try and protect kids from those threats.
Some medical needs are obvious and perhaps clear to see. Physical injuries are obvious, but I want to ask you about the mental health of people, in particular the mental health of children, especially those who are going to be returning home to what are effectively ruins.
Yeah, I don't think we talk about this enough, to be honest. I have been to a mental health session for children between the ages of 6 and 9 here just a few days ago, and the children sat in a circle to talk about things that made them sad, and the things that they spoke about were truly horrific, something that no child should ever have to endure. And there were children there with very serious symptoms of trauma, including one little 5-year-old girl, Mira, who has stopped speaking. Both of her parents were killed. She's now in the care of her grandmother after they were separated for more than a year. And her grandmother said she's really struggling to know how to help Mira move forward. So UNICEF estimates that all 1 million children in the Gaza Strip require mental health and psychosocial support. And that's going to be really key over the coming weeks as children readjust to life here in whatever way they can.
Tess, good to see you. Thanks for coming on the programme once again. Tess Ingram from UNICEF talking to us from Gaza City.